Hi, welcome. My name is Scott
Hey.
Suka. I'm the Executive Director for the Liver Coalition of San Diego, and welcome to our Liver Roundtable. And today's focus is hepatitis C and substance use. But before we get started, I'd like to talk a little bit about why today is happening and how it's brought to you. The Eliminate Hepatitis C San Diego County Initiative is one of our supporters today because the topic is connected. Our local initiative started in 2018 and worked with community partners as we put together our overarching recommendations report, and then ultimately an implementation plan that was approved by our Board of Supervisors in March and then July of last year. In January 1st of this year, the County of San Diego Health and Human Services Department contracted with the Liver Coalition of San Diego to serve as the convener of this partnership. Currently, this initiative is funded by the County of San Diego through the Health and Human Services Agency, and additional funding is provided through unrestricted educational grants and support through the Liver Coalition of San Diego from AbbVie and Gilead Sciences. So thank you so much for being here today. And it's my pleasure to introduce in our roundtable, which is really a unique format where we have more of a conversation as we become educated. And our educator today, guest speaker, is Ronni. She's the founder and executive director of the Hepatitis C Mentor and Support Group. Although she's based in New York, she does programs nationally, and she's my go-to person to call. And I'm very pleased to serve as her chair of the board of directors and just support her work. And she's helped educate me a lot in this area. So Ronni, welcome so much. And also Daniel, welcome, and Sue, welcome as well. Hi, Ronni.
Thank you. First of all, good afternoon, everybody. It is great to be here today, and I thank Scott and the Liver Coalition of San Diego for inviting me. Before we get started and having this conversation, I always love to see where people are about hepatitis C and myths. So if you would grab a pencil and paper, I'm going to throw out 6 statements, and I want you to mark them either true or false. And at the end of this, we're going to come back to them and see what everyone did. So when you're ready, let me know. Okay, the first one. The treatment for hepatitis C requires an injection. True or false? Children cannot get hepatitis C. True or false? Wow, that was fast. I guess everybody knew that answer. You cannot be treated for hepatitis C if you use drugs. True or false? Unlike syringes, sharing pipes do not put you at risk of hepatitis C transmission. True or false? Once cured, you cannot get reinfected with hepatitis C. True or false? And the last one, everyone should get tested for hepatitis C. True or false? Okay, I'm going to turn my camera off, and Scott's going to be kind enough to forward the slides for me. So you can forward it to the next one after myths. Thank you. No, the next one, I'm sorry. Okay, so just to give you a little background about how I got involved in this, and that's me. I made my IT guy make the woman blonde because he had black hair there, and I said, no, no, no. In 1996, I donated blood to my mother, who was having knee surgery. And about 2 weeks later, I got a letter in the mail from the hospital telling me that I needed to contact them. They were not able to use the blood. So the next day I went running over to the hospital thinking I had HIV, because in 1996, that's all I would have known about. And they said, oh no, you have hepatitis C. And I basically sat there and said, good. Little did I know what all that entailed and the journey I was about to take, because quite frankly, there was very little known about hepatitis C in those days. It had just been named. It was always called non-A and non-B before that. And unfortunately, this picture of the scream really talks about what it was like to go on interferon and ribavirin. I mean, it was totally the most horrific time of my life that I can really recall. And the doctor I had, the liver doctor I had, was very aggressive. He prescribed me to inject interferon 7 days a week. So I was a mess. The nurse practitioner started with this doctor the day I started my treatment, knew nothing about any of the side effects. And it was just really a very scary time. There were no support groups. Really, nobody knew very much, and the side effects were all new to everyone. So we were all learning together. And I stayed on the treatment 10.5 months, and every horrific side effect you could have had, I did. So when I finally got off, because I got very sick, I got neutropenia, which I'm sure you both know what that is, right? Do you? Shake it. No. Okay. So that's when your white blood cells take over and you're susceptible to everything. You're really in danger. And there's a drug called Neutrogen, also injectable, that they bring you back from it. So without going into all of that, I decided after 10.5 months and I was about 90 pounds and losing my hair. I was just a mess with all kinds of side effects. I told the doctor I was done with this, because I was obviously having no response at all. I still had the virus. So at that time, I did two things. And this is about the time I met Scott, as a matter of fact. I'm not the type to sit back and not know anything about what's going on. So I started to do some research, and the internet was in its infancy. So it wasn't like I could tap it and say, okay, this is what's happening. I really had to get on the phone and start calling. And I called the American Liver Foundation, and they had not opened their New York chapter yet, but they were expecting to in a couple of months, and they were going to have the person get in touch. And sure enough, about 6 months later, Scott Succo called me. He had just come to New York, and he and I started to work together. I ran what we called in those days the Manhattan Council, and we started our journey on hepatitis C kind of together. At the same time, I started a support group at NYU Langone, and it lasted 18 years. So I saw patients from the interferon ribavirin horrific days coming in, breaking down, having all kinds of experiences, to people coming in when the DAAs were approved and there was a cure, begging us to help them get the drugs. So it was very interesting, and I learned an awful lot about patients through this journey. Next slide. So I want to talk a little bit about, because no matter where I go, whether it's another organization, or even when we're advocating with legislators, everyone mixes up A, B, and C. And this is an excellent chart the CDC put out about A, B, and C. And, hepatitis A is highly contagious. It's spread from person to person through food or water when they don't wash their hands. But it is not usually, I know that some people have died from it, but that's so extreme. It's not something that commonly happens. You usually, after many weeks, it usually leaves. And hepatitis B is also a very serious problem. But most people in the United States have been vaccinated for hepatitis A and B. Usually you can't get into school. And I say United States because this is not the case around the world. And unfortunately, hepatitis B is very big in certain countries and certain populations. It can also lead to serious problems such as liver damage and liver failure and liver cancer. There is, however, as I said, a vaccination, but no cure. That is something they're working on right now. I know there are certain drugs that if you're on them, I'm not an expert in these, so I really will just tell you the general that there is a medication, but it is not curable at the moment. Hopefully that will change. And hepatitis C, also serious complications, including liver failure and liver cancer if it's not caught. The treatment today is a breeze compared to what it was when it was interferon. I mean, I literally called my doctor up and asked him if he was sure he gave me medication and not placebo. And I was not in a study because the side effects were so minimal compared to what they were with interferon. So, if you have to have hepatitis C, this is the time to have it, because not only is there the minimal side effects, but you can be cured in 6 to 8 weeks, which is amazing. And I think the thing that everybody should be asking their patients, very importantly, is have they been vaccinated against A and B? So just to sum it up, A and B have a vaccination and C is a cure. Next slide. Now, all adults 18 and above are recommended to be screened for hepatitis C. And the CDC recently, and several other very large organizations, which we'll get to later, have recommended that all pregnant people should be tested at least once during every pregnancy. And there are 2 tests, the antibody test, which is the finger stick. That's also called the rapid test. And that will tell you if you've been exposed to hepatitis C. But then you must get a confirmatory test, which will confirm, obviously, whether or not you actually have hepatitis C. Next slide. Let's talk about the risk factors. So, of course, sharing syringes to inject drugs and hormones and steroids is something we have recently become aware of, and it's important that people just don't share syringes. Tattoos and body piercings in unregulated settings, prisons, people's parties. It's frightful what's going on with this. And it's not only about the needle that they used for the tattoo, it's about the dye, the ink, because if that's been opened and used on somebody, that's another risk factor. Someone, of course, who's had hepatitis C. So make sure going to a tattoo parlor, number 1, that they're regulated, and number 2, that everything they use on you is sterile, new. Anyone who has had HIV or has HIV, absolutely. The good thing today is, it used to be that unless you had HIV under control, you could not do the hepatitis C medications, but now you can. And that's just a wonderful thing, because it is actually the hepatitis that is the danger to the person with the HIV if that's untreated. So the good thing is they too can get the DAAs and also be on their medication. Then anyone, of course, who received a blood transfusion or any blood components before 1992, they were not testing for hepatitis C before 1992. So that's another way we've gotten it. Actually, that's how I got it. I've had many hip surgeries, and somewhere along the line, that's how I got it. But you know what? It doesn't really matter where someone got it. The point is they have it and we need to get them cured. And then if you've had history of incarceration, today, hopefully in most prisons, they are addressing this. I know that in certain ones, they're even have people on treatment, depending on how long. And that is like another section that is very interesting, and people are really making sure that people are getting treated. And then, of course, children born to people who have hepatitis C, exposed children, very, very important. I'm going to go into that a little bit more later, so I'm just going to leave that for now. And sharing drug use equipment, people don't understand, you know, and again, I'm going to show a chart about how long the virus stays on certain things. So that includes cotton cookers, the water that's used for drug use, not water we drink. So I want to make sure everybody understands that. Sharing pipes and straws for smoking and snorting drugs. 2 reasons. If you happen to have a sore or cut on your mouth and someone else and you have hepatitis C and you're using the same pipe, another way to transfer it. So it is a risk. And snorting drugs, all the veins in your nose could have blood vessels that burst. So again, chance of exposure to blood. And then people that have had occupational syringe sticks. We have a doctor here in New York. I know Scott knows who I'm talking about, but I don't feel comfortable mentioning names. But he himself actually cured himself of hepatitis C because as a resident, he had gotten stuck with a needle that someone had hepatitis C. And then sharing personal care items such as razors, clippers, or toothbrushes. Very important that you don't have anyone else in the household sharing. And even this is so out of the box that could happen, but it's something to think about. And if you have had hepatitis C, you got cured of hepatitis C, and then you're using an old toothbrush, who knows? I mean, I can't tell you that there's data on that. I'm sure there's not. But again, if blood has been present. And I always tell people when they go to the nail salon, make sure you bring your own equipment, cuticle scissors and all that. You know, you don't really know how sterile the equipment is. I bring my own, and that way at least I know it's mine. And then
Ronni, I have a question. It's interesting because early on when I was working with you in New York many, many years ago, occupational risk for like construction, and we would get calls from HR directors saying, hey, we have an employee who has disclosed that they're positive, and can he, if he's cut on a piece of equipment, can that expose it to other people? And we would use kind of this very general, like, well, it'd have to be an open cut to open cut and connected, and that's not going to happen in the workplace. But then when you hear about an accidental needle stick, it's a very small amount of blood. So
anything blood to blood.
Yeah.
You know, I just had a doctor friend of mine actually on a training that I do. We talked about menstrual blood, and there is no data on it. And this doctor got very upset with me that I was even mentioning this because there is no data on this. But the way I feel is it's blood to blood. I don't care what it is. If blood is involved, and you are living with hepatitis C, Who knows? We don't know. Look how many people, I don't know about all of you, but so many people have told me they have none of the risk factors. They have no idea where they got it. So who knows? We do know it's blood. So therefore, why not be careful? So that's my feeling. But you're absolutely right, Scott. Thank you for sharing that story. Okay, next slide. Here's the chart I was talking about. So, of course, you know, again, people who share equipment, injecting drugs, again, insulin, hormones, people who shared snort, cocaine, and if you see on the bottom of this chart where we have pipes, it says unknown, and that's because that has not been studied about the length of time that it can survive, but they know it can. So again, if someone has open sores or cuts or whatever, just don't share. And pipes is a real issue now anyway. But this has been a really useful chart to a lot of, even I've given it to many syringe exchange programs because it really does give you a really good indication of how this virus can live. I mean, syringes, 63 days. You know, people talk about using bleach. Now, if you have nothing, I understand that. But the truth of the matter is the virus is a minuscule little speck that gets into nooks and crannies that no way is bleach going to clean. So I think it's just, we have to keep reiterating to people that they must use clean syringes or their own. If they have to use their own, just keep using your own. Just don't share it. Just no sharing. Very, very important. And again, pipes. They were overlooked for a very long time because, and if you go, yeah, please go to the next one. Thank you. I'm glad you did. So I talked about this because, again, I didn't see too much information about non-injectables, and it's another risk factor. So especially if you look at some of the ways that people make pipes, soda cans, I mean, aluminum foil, it's just so common that blood could be involved in any of these. And you know they're sharing these. So again, it's another problem, especially with crack and crystal meth pipe sharing. It's very big. So we are, again, if we could get people to have their own pipe, it would be wonderful. But I'm sure you all heard that the White House did not include, when they talked about harm reduction, they did not talk, they made a point of saying that while they were going to fund a lot of these drug programs because of the opioid crisis, they were not going to pay for syringes and pipes. So pipes has come up many times as another way of transmission. And people just don't think about it. So if you can, just kind of reiterate that to them. Okay, next slide. So we talk about safer smoking tips. If you are going to smoke your drugs, don't share. Make sure you're hydrated so you don't get dried and cracked lips. Lip balm so that happens. And if you can, maintain good dental hygiene, because if you don't, that can be another issue, bleeding, swollen, the whole thing. So hopefully people can be aware of these risks and at least practice some harm reduction here. Next slide. Okay, so we touched upon this a little bit before. It is rarely spread during sex, but it definitely can happen. It is spread during sex with a partner who has hepatitis C when blood is present. For example, men who have sex with men are particularly at risk of infection. Anal sex, which can cause tiny tears. Other times, and here's where I was talking about with this doctor about menstrual cycle and rough sex. And then sexually transmitted infections, STIs, which can cause open sores. People using drugs definitely can decrease inhibitions, leading to much riskier sex practices. And, they call it chemsex. And it's really important that people understand that this is a great way to transmit infections, not only hepatitis C, but many infections. So again, if they could practice and call this harm reduction in sex, we would be great. Next slide. So this is a slide I was referring to earlier that I wanted to wait to talk further about, and that is children, adolescents, and pregnant people. And those are the two recommendations I had told you before. I started to see a number of years ago as I was traveling this country, especially working with some of my partner organizations throughout other states in the Appalachians. When we were in syringe exchange programs, people were coming in with their children. And a number of these people had tested positive. And when they test positive and I'm there, they send them over to me to, talk about hepatitis C. And so I would ask the people if they had had their children tested, not only their children, but anybody else in their household. And the usual answer was no. And it started to make me understand that there was a whole group of people that nobody was paying attention to. Yes, they were talking a little bit about people that, pregnant people that gave birth and the children were exposed, but they weren't talking about what happened to those kids afterwards. So I started to call some pediatricians around the country and found out that there was no work being done around this. And we have now put together a whole team and are working on materials around these issues. The universal screening for hepatitis C recommended in pregnancy. These are the organizations I was talking about. The CDC, we said, the USPSTF, which is the United States Prevention Services Task Force, and the American College of Obstetricians and Gynecologists, which is major important, and under other pediatricians who not necessarily really know how easy it is or even to look for hepatitis C. The problem is what we're finding is a lot of these parents are using drugs. And if they take their child now, the disconnect is between the hospital they're born or wherever they're born and then the pediatrician. They take them to the pediatrician. They don't necessarily disclose to them that they had hepatitis C and that their child could have been exposed because they're afraid. And there are 3 states in particular where you will be charged with child abuse. It's a criminal offense, using drugs during pregnancy. And in some states, they will take the child away. So they're not always open with the pediatricians. And then you have foster children and children, immigrants coming into the country. There are so many issues with children that they're falling through the cracks. And then you have young adolescents and adults who are getting tattooing and piercing. They're having parties, doing it themselves. They're using the common denominator of it all is that many of these different sections of generations are using drugs. So again, they're being exposed there too. And so the problem is that the guidelines start testing at 18 and up. However, thanks to companies like AbbVie and Gilead, their drugs are, and I don't usually push pharmaceuticals, but I'm doing this because I think it's phenomenal that a child can be treated at 3 years old and doesn't have to go through life having liver disease that they should not have. So I'm thrilled that we do have this, but this is something that not a lot of pediatricians are aware of. So we are working on materials to put in their offices and also around the country. And if anybody's interested in those, you can contact Scott and we will definitely get them to you as soon as they're ready. Mother to child transmission is, of course, the most common cause of hepatitis C. And again, as I told you, 3 years old, they are doing studies right now on people being treated while pregnant. They're finding that these drugs are tolerable and not necessarily dangerous, and it's looking really promising. So, let's stay tuned and see where that goes. 25 to 40% of infants do clear. It's like, I'm sure you all have heard that 20% of people diagnosed with hepatitis C clear it on their own. Nobody really knows the answer to how that happens or why that happens, but children, 25 to 40% of the infants clear hepatitis C by the time they're 2 to 3 years old. So that too is a wonderful thing. All children of parents living with hepatitis C should be tested at 18 months of age and referred to special care as needed, because again, they can be treated. Okay.
Ronni, you had mentioned that could be treated during pregnancy. So if the mother got cured, what's the impact on the child? Would they be cured also, or they'd have to be treated at 3?
They can't be treated till they're 3.
Okay, so if they're in the womb and the mother's undergoing treatment, whether or not she gets cured, doesn't pass to the child.
That is a question I would have to go to one of my providers and ask her, because I'm not 100%. These are the studies that are going on now, so I don't know how to answer you on that, but I will absolutely get back to you on that.
And for folks that are watching after today, know that in the YouTube chat box, we actually will put the answer to the question. So
great.
When Ronni, when you get that to us, we'll include it in the description, and we do that with any unanswered questions. Thank you so much.
That's great. Absolutely. Okay, let's go to the next slide. So what are the challenges? And of course, stigma. And I always ask people, what does hepatitis C's challenges and stigma look like in your organization or your community? Do these people have friends and family? How is their health care and treatment? How have they been treated? What do they feel about that? Personally and emotionally. And I think this is, it impacts you in so many ways. And I think that all of this needs to be taken into consideration, not only when one gets first diagnosed, but living with it, even after they're cured, it always has impact. And then, of course, their peers and what kind of support systems do they have? When I got originally diagnosed, I was never a big group joiner, but there were no support groups, and people started to talk to me. There was a transplant nurse up at Mount Sinai, actually. She was phenomenal, who put together a group. And I have to tell you, for myself, who, as I said, was not a group joiner, it was amazing to be amongst people that understood what I was talking about, because I had been through interferon and ribavirin and all the craziness that went along with that. And, my friends didn't understand. How could they? My mother couldn't have understood, but people that were going through it understood. And it was like an amazing feeling to be in a room with people that totally got you. And be there to support one another, to do whatever we have to do and whatever we're facing. Next slide.
Ronni, I have a question for you.
Sure.
You're involved with the elimination initiatives in New York
Yes,
City
yes.
and New York State, and we're involved with our eliminations here in San Diego.
And I have a slide on that too.
Yeah, but here's my question. When you talk about stigma, it's kind of like there's language to use, and then yet in planning elimination with scarce resources, we're looking at infection rates by risk factor that may have higher prevalence. So by highlighting those, we're actually stigmatizing communities that might have, like, sex with men, those that use drugs, those that have histories of incarceration.
Not really. No,
But
no.
so how do you see that playing out in your part of the elimination?
Well, we did it. We did name them. As a matter of fact, we had 5 working groups, and we did name exactly what you're saying. You have to, and they do not look at that as stigma. What I'm talking about is where friends and family will shun them or think they're dirty or not hug them. Or I had a case of a woman who her daughter would not allow her to kiss her grandchildren, and when she came for dinner they would change the silverware, and things like that, or thinking you're dirty because you have hepatitis C. Because you use drugs and you have hepatitis C, because you drink. I mean, there are so many reasons. I find that a lot of people are walking around knowing they have hepatitis C but don't want to deal with it because, well, number one, it's not on top of their problem list. Some of them don't have a home to live in or don't have food to eat. But also those that know for many, many years, they don't want to deal with it. So those are the things that we try to make people understand, that their story matters. I think it's great when all of us share our stories, have people share their stories. And I talk about this, and again, I'm going to go to the slide on advocacy so we can talk about this. So I'm going to hold a little more. Is that okay, Scott?
Yep.
Perfect. Okay, great. So go to the next slide because I think it's the one after. So again, why the silence about stigma and shame, fear of judgment's a big, big thing. It really is. And then, again, they've had such bad experiences with the healthcare system. They go to an emergency room, and I have heard such stories that really my heart broke. Just here, like one person told me once that, not once, I've heard this story many times. They go to an emergency room with a wound and an abscess, and they were told, why should we fix that for you? You're going to be here next week. I mean, you took an oath. How do you treat a human being like that? So they've been so disrespected. They've had terrible experiences. They don't want to deal with this. And again, with hepatitis C, unless you're really at a bad stage, there is no pain. There is nothing showing. So that's also a problem. And of course, I said not a priority, people that are unhoused or lack of insurance. There's another problem, is not having. And then we have people that are dealing with mental health and other comorbidities, especially people that have so many other diabetes and heart things and so much going on. So there are a lot of reasons of why the silence. And that's why I think it's so important that we support people. Next, please. How to address this. So we try, of course, to educate everybody as much as we can. And I don't know if either of you have seen my new training. And Scott, if you would be kind enough, maybe you want to put the link in the chat box if you have it. And I really urge you to see it. It's 7 minutes long. It's got a wrap and a serious hepatitis C wrap. And it's colorful, educational, but people actually have fun, and it sticks in their head. They tell me this. I had an old training that I have a grant in New York, and I was using a training that was given to me to use. I'm not going to say by who, because I don't want to, since this is being taped. And quite frankly, it was very long, and people were just bored. They were just bored with it. So we created this new one, and please, I urge you to listen to it. So, of course, educating people where we can, having them stay healthy, which is another challenge in itself. and having them manage health issues and emotional care. And, I keep telling anyone that listens that can make things happen, and this includes, legislators, pharmaceutical companies, we need to bring the services to the people. Integrated services need to go to the people on the ground. They are not going from appointment to appointment. It just is not going to happen. And until somebody helps and gets us to have this happen, we are not going to eliminate anything. So that's something I feel very strong.
Ronni, are they using the term street medicine back east? Because I heard that for the first time, and I was like,
"Oh, did you hear that from Thaddeus?"
Yeah, I think so.
Yeah, that's a Hawaiian. Yeah. That's why I knew that.
But it's exactly what you said. It's taking it out of the medical practice, brick and mortar, and taking it right to the canyons or streets.
But all of it has to be integrated. We can't send them here for a test and here for an MRI. It's not good. I mean, it's hard for me, never mind somebody that's got all these issues going on in their life. So we have to be respectful and understand who we're dealing with and help them. They need help. And believe me, they will take it and they will be very grateful for it. And really, the thing I've learned about street people, they're very savvy. They know who's genuine and who's not. So it's an interesting thing. They have to live on the streets. They have to be very aware of what's going on. And here's what I kept referring to, especially around stigma. Get patients involved in advocacy. Tell them how much their voice matters. I have been with people in groups and I say to them, I'm going to DC tomorrow. What do you want me to tell them? And they look at me and they go, you care about, and I go, yeah, I want to hear from you what you want to see done. And I'm going to tell this legislator tomorrow. But if you can actually get the patient to go with you when you go on these visits, or even when you have educational trainings, have people that have lived experience, especially people on the streets and people who use drugs in different communities. It's so important that people understand this is everybody. We are all affected by this. So if you can just make people understand their voice matters, I have seen smiles and confidence come over people where maybe the stigma is, a little bit less. And that's what we're trying for, right? Okay.
Ronni, you've used some terminology that some folks that listen might be surprised with. So you've heard
what I say.
No. You see, people who use drugs, and sometimes people think they may not understand what harm reduction is. So if you could kind of explain what harm reduction means as you see it in meeting people where they're at in that journey, it might provide some clarity for people that may not work with the day-to-day.
Yeah. So harm reduction is just behavior where you're taking the risks away. It could be and some people debate that this isn't harm reduction, but it is. Wearing a seatbelt, wearing a condom, this is harm reduction. Just taking the risks away.
So you still might use drugs because you may not be willing to stop yet, but you can create some safety mechanisms that reduce harm to other things.
That's what my organization does. We do. I'm not here to judge if you use drugs or not. That is your life. That is your decision. I am here to make sure that you know how not to harm yourself and the people you hang with, because it's usually a group. And that's what I'm trying to do. And that's what harm reduction is. It's really simple. Thank you for asking that. That's a great question. Okay, so next slide. So support systems, I've mentioned it many times. We have what is called the circle model. It's actually, I took the whole concept of the support group and I made it into a modern day support group. And I don't call it a support group because I I was talking to a number of people one afternoon in drug court in Tennessee. And they all told me that the word support in support group just meant rehab to them or 12 steps or whatever it may be. They didn't like support group. And then I came back and I started to hear this in New York as well. So my concept is, it's the same thing, just it's modern day. So we sit in a circle. A circle has no beginning and has no end. It's an environment with no judgment. We try to build people's sense of worth. We try to empower them to be in charge of their own health by giving them the tools to be in charge of their own health. And of course, education. So we wear many hats in these groups. We teach other organizations, or in some cases partner with other organizations, and I have several in the Appalachians, where they use our model, our materials, and I go there once or twice or maybe 3 times a year and work with the staff and the patients. And they keep data for us. And it is proving to be very sustainable around the country, and we're very excited about that. And on the next slide, yep, okay, would you go to the next slide, please? Okay, so I talked about the environment. So you see these bags on the bottom right? So these bags are what we call educational counseling hygiene kits. And they're now referred to around the country. They're actually known as the purple bag. Where do we get the purple bag? And there's many reasons for that. On the bag, in the back, where you see all that printing, is risk factors printed right on the bag. And why did I do that? Because I love the bag and I love the contents, because a lot of it is stuff that people need for self-hygiene, especially houseless people, but also they can carry their equipment in these bags. But while they're doing that, I'm hoping they're looking at those risks and just have something stick in their head so that when they do sit down with whomever they are, that they remember they saw that, or they have it, or whatever it may be. It also has proven to open up a conversation about hepatitis and the interconnection to infectious disease. So it really has been a great tool. And then of course we added the mask with COVID. During COVID, we were handing these out in New York to all the houseless people because it was just a disaster here, as I guess everybody knew. So we have that. We have this online training that you all, that Scott was nice enough to put into the chat box, and how that works with participants is they get, once they watch the training, they register, they get a food card incentive to go, and there's a list of the restaurants that they can get food from. And we started this during COVID because people weren't going out, and while it's a small amount of money, it's $15. I still felt at least we could contribute to people getting something. So that was started, and we just have carried it over. We're doing it all over the country. We have it in New York in particular, in Spanish as well, because we have so many Spanish speaking people here. We have an informational newsletter that is totally geared towards patients. It's not one of these research, data and all that. It's all about, we don't put it out, we only put it out once or twice a year, but it's full of questions to ask your doctor, new information, what drugs they are using, and that all that information. I have a medical advisory board, and one of the doctors on that takes care of keeping that up to date. We do telesupport services as far as we can conduct these trainings via Zoom or via whatever it needs to be, and have been doing that, especially during COVID. And we have a great website. We have good following, people in the community. We send out messages all the time of information, and our blog got awards, big deal. But anyway, that is what the circle model is. If people are willing to keep the data, that we would love for them to become a circle model. That's what that's about. And then I guess I jumped ahead myself. This is what we did during COVID, which I've already told you. So now you can jump to the next one. Here's what I was told. So I love this comic, but it's a little more than 25 years, but it's okay. Here, I urge anybody. San Diego has an elimination plan they're working on. Get involved. Scott Succo's the guy to go to. Get involved, because we can eliminate hepatitis C, and we need to. And if we get the right people involved, I want to get children involved, youth involved, and create a youth movement. So I've been talking to pediatricians about that, and they're loving it. But, I think it's going to be a little bit older. I think it needs to be more adolescent and young adults, because the truth is they're the ones that could really go out there and make some noise and advocate. We're getting old, at least I am. Okay, one last thing, and we're done with the slides. The myths. Let's go and see if everybody got them right or wrong. Okay, Scott, all right, so treatment for hepatitis C requires an injection. What'd everybody say?
I said false.
Okay, Susan? Susan?
Sue. Oh, I've got my board president next to me. She's like, I'm saying false.
Everybody says false, right? Okay, put it up.
Oops, hold on here. There you go.
Just click it.
Yep, false.
Everybody got it. Okay, great. Children cannot get hepatitis C. What'd you say?
False.
Daniel?
Oh,
Good.
Susan?
False.
Okay, good. Hey, you guys are just too smart. That's the whole thing. You cannot be treated for hepatitis C if you use drugs.
false.
Sure on that. That was true.
I thought that might be different based on each state, but in California it would be false. But I don't know if in other states.
But you can't, but they're talking you can be, but it's not a matter per state. It's a matter of you can be treated for hepatitis
Gotcha.
C if you use drugs. Doesn't matter where you are.
Gotcha.
It's the overall.
Excellent.
Okay, great. All right, next. So if you get this next one wrong, you weren't listening to my slide. Okay, unlike syringes, sharing pipes do not put you at risk for hepatitis C.
False.
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 Yay, everybody was listening. Okay, cool. Once cured, you cannot get reinfected with hepatitis C.
False.
Yep.
I put false, but I really wasn't sure on it.
Oh, you absolutely can get reinfected if you go back to risky behavior. Absolutely. And it can be worse the second time because of two things. One, if you have a different genotype than you had before, and that can happen. And that is not as bad as insurance. Not all insurance companies are going to pay for it twice. So depending on what state, that could be a real problem.
I had help. I'm introducing my board president. She's been here watching.
Hi.
She's like, false, false, false. Hi, Rita. Join the fun.
Okay. Hi, Rita. So the last one, everyone should get tested for hepatitis C.
True.
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 Everyone, absolutely. Okay, that concludes my slides. Now we can just talk.
Great. You know,
Oh.
Ronni, we've had a lot of conversations about stigmatizing terminology. And
Yes,
so I
language,
remember if you
language,
kinda
yes.
could
As
share
a
like
matter
top
of
five.
fact, As a matter of fact, I just had a meeting with my program manager about including that on our website under resources. I want to have, language is very important. Words matter. Words are stigmatizing. And for people who use drugs is one set, and now with transgender people and gender equality, it's a whole nother set. And so I try very hard to make people understand that we need to be respectful of other people, and language is one of the main ways to do that. So when those are put up, I will also share that link with Scott, and you can all have it. It's a great lesson to have. You know, things like never say to somebody, how long have you been clean? That connotates they've been dirty. You know, they may call themselves addicts, but it's not right for us to do that. And then in transgender, very important with she and they. And, you know, I have found, a friend of mine recently called me and said, because I have someone in my family who's transgender, so I'm very cognizant of it now. And when I talk about them, to my friends, I always say they, and everybody gets confused because they don't think necessarily transgender. They think I mean two. And they'll say, but I thought you said only your cousin came. And I was like, I did say it. So this person called me recently and said, I just ran into a situation. Could you tell me how to handle this? Someone in her company, she was sure she was trans, but wasn't sure if they were she or he or they or what. So I said, actually, people really appreciate if you ask them, what pronouns do you use? And she said, really? As simple as that? I said, that's all you have to do, and you will be their best friend if you keep in the realm of talking to them with the proper pronouns. Now, I slip up very often. I've known, you know, my family members since they're a little child. So as a she, and now they're a they. And so I slip once in a while and say things, but I quickly correct myself. And we've talked about it, and they have said to me, I appreciate how quickly you correct yourself. I also work a lot with the transgender community. So again, I tried to be very, very, very respectful of this. So again, I will have that link, and I will make sure Scott shares it with you all.
Yeah, and Daniel, I noticed your mic
I'm glad you
was
brought
off
that
too.
up. As
Did
a
you
matter
wanna-
of fact, I'll tell you something interesting. Did you notice during my talk about children and everything, I kept saying pregnant people?
Hmm.
I didn't say mothers, I didn't say her, I said, because again, not all people who give birth consider themselves women.
Hmm.
So I just had a talk with I have one of the people on my medical board is a liver doctor who treats pregnant people. And on her slide, she kept referring to her and mothers and all this. And I had to talk with her about it, and she totally agreed. And I did a webinar last week. If you'd like the link to that, it's really interesting. It was done with all of these pediatricians, pregnant people, doctor, and someone who does harm reduction. And in the very beginning, I say to the audience, because we did a roundtable also, I said to the audience, not everybody is considers themselves women. So cisgender maybe. So we explain that why it's said different ways throughout the conversation. And it's a really good slide. It's very respectful. As a matter of fact, a lot of the feedback I got besides the information the doctors were talking about, they told me this particular slide really was meaningful. It was impactful that we said that. So again, I can share that with you too.
Daniel?
Sorry, I was having some trouble getting off mute there. But yeah, I think that with this particular disease state, there's a lot of stigma, a lot of apprehension to treatment, a good amount of shame when it comes to getting treatment. So making sure that we are very intentional and specific with what our dialogue and verbiage is, and making sure that we can foster a very comfortable environment for these patients is imperative in getting them to treat, I think.
Especially the transgender community, they are very leery of the healthcare system. They've been treated terribly.
Yes.
Excellent. Well, I do want to bring, we're just 2 minutes over our hour, but this was a perfect discussion. Exactly what we had talked about,
I
Ronni. So
enjoyed it.
thank you for delivering.
Thank you.
Well, thank you. You are a
Yeah.
great group to work with. Thank you so much.
Thank you. So this webinar will be, it's been recorded. This is actually Roundtable. It's been recorded. It'll be uploaded onto our YouTube channel and our website. And really it's a resource that you can watch and rewatch or watch in segments based on how you choose to digest the information or share it. So thank you so much for being part of today, everyone. And if you're watching after the fact, always consider us a resource and look at some of our other online learning opportunities. So thanks so much and have a great day. Bye, everyone.
Thank
Bye.
you. Bye.